So in today's session, we're going to be looking at techniques that can help support those of you who are struggling with joint pain. This can be really common with those of you that are on hormonal treatments, which can reduce the levels of estrogen in the body, and that can cause stiffness and pain in the joints. But please be sure that if you have got new pains, joint aches that are not normal for you, then always be sure to get that checked out by your healthcare team, and not using any of these techniques as a substitute to getting those things checked over. So what we're going to start with is looking at how our joints stay strong and stay healthy. And what's really important is that we learn to move our joints, starting with the smaller joints and then moving to the larger joints every day through their full range of motion. So obviously a joint is where two bones meet. On the ends of all of our bones is cartilage, and that cartilage helps the joints to move over each other, the bones to move over each other smoothly. And around every joint is a synovial membrane, okay, and inside of that synovial membrane is synovial fluid, which is like WD-40, and that fluid is produced by the membrane, and it's stimulated to be produced by movement. So if we're spending less time being active, then those joints are not being produced and given enough of that synovial fluid to keep them nice and supple, and that WD-40 doing its job basically. We also know that having therapy treatments like radiotherapy and surgeries with the scar tissue that can create, and with radiotherapy that can be long-term effects. It can be causing tissue tightening many months after treatment finishes. That also will lead to joint pain and stiffness. There might also be, pre-existing conditions like osteoarthritis. Again, that's when, the joints are not getting lubricated as they should. There's damage to the cartilage, and then you're getting inflammation and increase in tissue fluid around the joint, which limits the motion that we can get. So all of these techniques are supporting movement in the limbs, movement within the joints, and we're also working with the fascial system. So that's like kind of a web-like structure that covers all of our body. So it's like, if you can imagine like a wetsuit that's all the way over our heads, all the way down to the tips of our fingers and down to the tips of our toes. And that can get really tight as well because of scar tissue, lack of movement, all of the things we've just gone through now. And so we're going to look a lot at techniques to help free the fascia, okay? And that fascia, its job is to hold all of our organs and muscles, and allow them to move nicely over each other. So if there's tension and tightness in the fascia, then we're going to, experience a reduction in our movement. And something that might be happening, for example, a fallen arch in the foot, that could be causing us problems in our neck because of the fascia, because it's interlinked, it's the whole body. So let's think about the body as a whole, okay? So you might think, well, I've got problems with my shoulder, but we're working on the toes. It's because it's all interlinked, and we need to look at the body as one unit. So let's just get comfortable. So I'm just sitting, making sure that my bottom is higher than my knees. So you might want to pop a couple of blocks, or you might want to sit on a chair, whatever's most comfortable for you. If you're seated, you want your hips above your knees, and so there's no strain in the knees. Just finding what's comfortable for you so that you can sit with your spine long and that you're pain and strain free. All of these exercises should be pain and strain free. Yes, feel a gentle stretch, but not going into pain. So let's just start with the hands, okay? So we're going to start with the smaller joints, moving up to the larger joints. So we're going to do something called fascial flossing. So the fascia is around all of the nerves in our arms that come all the way up into the spine. So we can stretch them one at a time. So let's start by putting the thumb onto the top of the thumb to the top of the little finger. I'm going to start with the radial nerve that runs here. So we're taking the index finger and we're just gently stretching the index finger away. Now, if that's feeling okay, you might want to straighten the elbow we're just taking a few breaths there, making sure your shoulders are drawn back and down, your spine is long, your neck is free. So not holding any excess tension anywhere. You can do this in a chair. And then releasing. Then we're going to take the middle finger and we're going to reach that one back. So again, with the elbow bent, if that feels like enough, and then straightening the elbow if you can. So you'll feel a deep stretch all the way through that finger and up the arm potentially. And actually the nerve endings are in our fascia. So when we feel that sensation of a stretch, it's from the fascia. That's where that information is coming from. Keep breathing, knowing that if we're holding our breath and maybe we're doing too much, taking the stretch too far. And then releasing that. And then taking the ring finger and the little finger. So we're letting go of that little connection we had there. And stretching those two fingers. This is the ulnar nerve here. And stretching. Taking a few breaths. Good, and then release, shaking that out. And then we'll do the same on the other side. Our thumb and the top of our thumb and the top of the pinky finger join. And then we're going to just gently take the index finger, stretching it back. And if you want to, straightening the elbow. Good, and releasing. Then we're taking the middle finger, so that median nerve now, stretching away. Good, and then the ulnar nerve, which is the ring finger and your little finger, stretching away. Good. Good, and releasing. And then let's just do flicking. Imagine you've got lots of water in your hands and you're flicking the water away from yourself now. Flick, flick, flick. And then we're going to take the thumb into a gently closed fist. Okay, and we're going to do some circles with the wrists. And again, you might want to straighten the arms and circle in one direction. Mine are doing squares more than circles here. This is really good if you are spending a lot of time at a computer. It's kind of getting into here and here where there's, you know, your tennis and golfer's elbow can happen. Good, and again releasing it off, shaking it out. And then we're going to go into the shoulders here now. Okay, so this is really good for the side effects from having surgery and potentially radiotherapy. Okay, so we're getting into this area. So let's just start by having the arms out at shoulder height, and we're going to tap the shoulders and release straight. We're going to inhale, tap, exhale, straighten. Inhale, tap. Exhale, straighten. Inhale, tap. Exhale, straighten. Good. Inhale, tapping. Exhale, straighten. And releasing it down. Good. Little rolls. Back. And then forwards. 1, 2, 3. Good. And we're going to take our arms into like a scarecrow shape here. So the shoulders and the elbows are at 90 degrees. And we're just going to allow the arms to rotate down and then gently bringing them back up. So we could inhale as the arms come down, the palms come to face away. Inhale, exhaling, palms facing forwards. Inhale down. Exhale, bringing them up. Checking in with your lower ribs, so we don't want them jutting forwards, tucking the lower ribs under. Inhale down. Exhale up. Good. One more. Inhale down. Exhale up. And again, release and just shaking it out. Good. And then we're going to take the hands out again at shoulder height, and we're going to just rotate open so the palms are facing up and down. Inhale up with the palms, rotating the arms. Exhale down. Inhale up. Exhale down. Inhaling up. Exhale down. Inhaling up. Exhale down and releasing down, and just knowing that, you know, if things get tight and stiff, and then because they're tight and stiff we move them less, then they're going to get more stiff and more painful. So it's kind of a downward spiral. So we've got to just start nudging in there and getting that movement back. Then we're going to interlace the fingers, and we're going to turn the palms away, and we're just lifting the arms up as far as is comfortable, pain and strain free, and then exhale, drawing the arms back down. Inhaling up. Exhale down. Inhaling up. Exhale down. Inhaling. Arms come up. So the arms are up, but the shoulders draw down. Exhale down. And again, noticing if you're overcompensating. So if you're leaning forward to be able to get the arms up, just tucking under, tucking those lower ribs under, and just seeing how far you can comfortably go. So you might not get the arms so far, but that's fine. And exhaling, coming down. Good. Then we're going to move into the feet. So this, go gently with yourself on this one. So we're going to move into the small joints in the feet now. Okay, so again, you know, releasing with the joints and the fascia in these small joints can have a knock-on effect in the whole body. So we're going to take the right foot, and we're going to use your left fingers to go in between each of your toes. Now this is difficult, okay, so just see what's comfortable for you today, okay, and just work on it. It's something to practice. So what we're going to do is going to first of all try and open the toes. So we're abducting the toes, taking the toes apart, so pushing your fingers apart to push the toes apart, and then squeeze your fingers with your toes, and then again pushing the toes away from each other with the fingers, then squeeze the toes, pushing the toes away. We'll do one more, squeeze the toes, and then making space between each toe. Great. And then we're going to take hold of the toes and we're going to stretch them back. So we're stretching back, pushing the toes back, and then the other way. So stretching again, we're going to stretch over the front. And you might notice that your shoes are actually kind of, the toes come up often in shoes. So it's really good to just stretch our feet in the opposite direction. And then just doing some circles, and in the other direction. Good. The other way. Good. And then changing sides. Okay, so we've got our left foot. When you use the right hand, put our fingers in between each toe. And again, we're going to squeeze the fingers with our toes. Squeeze, 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 squeeze. And then pushing the toes away from each other, giving some space between the toes now. And then again, squeeze the fingers with the toes. And then stretching away. Squeeze. So you might feel as you practice this, you'll be able to get a little bit more and a little bit more space between the toes. And then squeeze. And last time, stretching away. And then we'll do the same as before. So we're bending the toes towards us. And then pushing them away. Bend towards, pushing them away, and some circles. So just getting into those bigger joints at the base of the toes there. Our poor little feet just don't get no attention at all, do they? We just stuff them in the ends of our shoes every day. And releasing that. And then just having your toes and just making a fist with your toes. So just squishing the toes and releasing. Squishing the toes, making a fist with the toes and release. Squeeze and release. So the same as with your hands, you're releasing the toes like you've got water on them. Good. And we're releasing it there. And I think whilst we're here, we're going to move up to the hips, okay? Because we're already on the floor. So here we are, okay? And we're just going to take the feet quite wide and just allowing the knees to fall from side to side. So this is quite good for hip tightness. So just allowing this dynamic warming up of the hip joint here. Letting the knees roll from side to side. It can be really nice, but if you have got a lot of stiffness, it can be quite sore. So then maybe when you get to one side, just walking the hands around and walking away from that side. So just getting stretched through that side of the top side of the hip. Taking a couple of breaths there. Just moving around, like where is that stiffness? Where can you get a good stretch? And then coming back to center, then allowing yourself to go to the other side. Can you walk yourself away? Getting a stretch through that top hip. Breathing into areas of tightness. Good, and then gently coming back and just doing, this is a nice one just to practice, you know, doing a bit of extra ones if you feel like your hips, everybody's holding tension, feeling joint stiffness in different places. So just doing what's comfortable for you and what you need to work on. You can do a little bit of extra potentially. Okay, so then we're going to come into the shins and the front of the feet. So coming into all fours. Okay. And from here you could just sit back onto the heels, so you're getting a stretch here through the feet. Okay, how far can you comfortably go? Can you come all the way up? Maybe, maybe not. So just doing what's comfortable. Just walking back, stretching. Good, and then releasing back down. And then you could put the top of the feet flat on the floor. Good, and from here, can you just gently see if you can raise your right knee? So you're going to get a really deep stretch, probably in the front of the front of the foot into the ankle and shin there. And again, we'll raise the left knee. Right knee lifts. This can be intense. I'm finding this quite intense. So just gently getting in there. And the other side. Good, and then releasing that off. Okay, and then we're going to come up into standing. Now what you might need is a towel folded over, okay, and we're going to put it under the foot. So if you have any toenail issues from chemotherapy, it might be very sore for your toes, so just leave this one out. So if you've got any problems with the toenails, then leave this, okay. But quite a nice stretch here is to put your foot onto a folded towel, which I don't have right now, but you can get a folded towel. And we're going to put the tops of the feet down, okay, and we're going to bend the knees together and then straighten up. And so you should feel a stretch in the front of the calf there. Bend the knees and then straightening up so the feet are hip width apart here. If you're feeling your balance is challenged, you know, go and find something to stand near to do this exercise. And then changing sides, so feet hip width apart, taking your left foot behind you this time, bending the knees, then straightening. And again, we're stretching the fascia through the front of the foot there. Good. And then release and shake it out. Good. And then a really nice one is to do some standing, and we're going to bring the arms up in front of the head here. So we're going to inhale, we're going to have the feet hip width apart again. It's going to be challenging our balance, so if you need something to hold on to, then be sure to be near something stable so that you could grab hold of it. We're going to inhale, come up on the tippy toes as we bring the arms above the head. Exhale, come down. Inhale, come up on your tiptoes as you reach the arms up and over. Exhale, come down. Inhale, tiptoes. Exhale, down. Inhale, coming up onto the tiptoes. Good for your core, really strengthening for the core and all the muscles around the ankles. Exhale, down. Good. And releasing there, just shaking it out. And then the nice one also is just to come to the back of your mat and take a step forwards here. And we're going to imagine there's a line through the middle of the mat. So we're into warrior 2. So our ankles, our heels are in the same line. So we're in our warrior 2. The front knee is directly over the front ankle. So you're not overshooting, so check on that. The hips are open to the side. And we're going to bring the arms up at shoulder height. And here it's just really nice to do up and down with the wrists. So this is nice and strengthening, but we're also getting a lovely stretch through the wrist joints here. Good. And releasing it down, and then changing to the other side. So we'll bending through the left leg here, and the right ankle and the left ankle are on the same line. So imagine there's a line through your mat there. Lifting the arms up, and we could do rotating here. Inhale, open. Exhale, checking that front knee is not overshooting your front ankle. We're putting the pressure into the outside of your back leg so that you're maintaining a nice arch in the back of your right foot there. Good. And releasing it. And then we can heel toe to come in. And another nice one to do just to finish off today's session is to take yourself into horse stance, so nice and wide with the feet. The feet are kind of in a 10 to 2 position. You're bending the knees and coming down with a straight long spine. We're going to tuck your elbows into your sides, and we're just going to inhale, open, and exhale, bring the hands together. Inhale, open, keeping the elbows against your sides, elbows tucked in, ribs tucked under. Inhaling, open. And what we do in everyday life, so much of our life is forward facing, okay? If we've had scar tissue, everything's bringing us forward, okay? So these exercises are great to lengthen the front of the back and the front of the body and strengthen those muscles and tendons that can get long and weak on our backs. So this is a really lovely stretching for the front and strengthening for the back. Inhale, open, exhale, close. One more, inhale, open, and exhale, close. And then releasing heel toe to bring it in. And that is all of the postures for this session. I hope you found that helpful. It's always lovely to do a shavasana, so just take some time just to lie down and just feel the effects of that practice. I've gone through quite a whistle-stop tour, but just taking your time, stop and pause the video at any point through these exercises. Feel the effects of the practice. Take a moment now just to feel into your joints. You know, come down and be in a lying position and just feel how it feels to have moved and given all those joints that lovely bit of care, really, moving them through their full range. That's what they want to do. That's what they're designed to do. And I'm also going to upload a little joint freeing meditation for those of you that want to do that. So that can be a really lovely thing to do at the end of this session. I hope you find it helpful.